The federal shutdown revolves around health care and how much it costs. And to understand what this is really all about, we need to start with a look back at the Affordable Care Act.
Nothing made me prouder than providing better health care and more protections to millions of people across this country.
President Obama signed the Affordable Care Act, which became known as Obamacare, and it gives patients more protections in their private health insurance. For example, parents can keep their kids on their plans until they turn 26, and you cannot be denied for having a pre-existing condition. Now, to help pay for those protections, the law used to require people to buy private health insurance if they can afford it, and the government still subsidizes coverage for many to make it affordable. But a lot of people did not like the idea of government deciding whether you could afford to buy something and then imposing a mandate to buy private health insurance or face a tax penalty if you don't. And so, when Donald Trump first ran for president, he called for something very different. Trump promised health care for all, paid for by the government.
Everybody's got to be covered. This is an un-Republican thing for me to say.
Universal health care.
I am going to take care of everybody.
Who pays for it?
The government's going to pay for it.
But when Trump took office, he did not advance a plan to do that. Instead, Trump endorsed House Speaker Paul Ryan's plan to repeal and replace Obamacare.
But very importantly, it's a great plan. And this is a real plan. But we're just going to talk a little bit about the plan, how good it is.
Under that plan, the CBO projected some 22 to 23 million people would become uninsured by 2026. And critics feared that it could drive up costs for people with pre-existing conditions to the point that many could not afford it. Well, as it tanked in the polls and critics called it mean, Trump then backed away from Ryan's plan and called it mean himself.
I actually used my term, mean. That was my term.
So Republicans then called a vote to wipe out part of Obamacare and come up with the full details on a replacement plan later. But Senator John McCain said that would have killed off essential provisions, causing the whole thing to collapse. And then he cast the deciding vote to save it in 2017. But also in 2017, they did phase out the unpopular penalty for not buying private insurance. And that was a turning point in which the Affordable Care Act became increasingly popular among voters. But Trump still reduced some subsidies for it, SCR payments, what they're called, and also backed a court battle to try to end the whole thing.
I hope that they end it.
Fully developed replacement plan, but did not present it to the public.
So why didn't you develop a health plan?
It is developed. It is fully developed. It's going to be announced very soon when we see what happens with Obamacare.
Well, Obamacare survived the court battles, and President Biden won the 2020 election. And with a COVID health crisis, Biden increased the subsidies to make it more affordable to buy private health care. And he expanded the number of people who can get those subsidies through what's called premium tax credits. Those enhanced subsidies were part of easing us through and past the pandemic and the jolt of inflation that followed, and are set to expire at the end of 2025. And that's the flashpoint that triggered the federal government shutdown. Democrats want to extend those enhanced subsidies, and Republicans have not agreed to do so. And again, that impasse led to the shutdown.
Republicans control the House, the Senate, and the presidency, and unfortunately, they've made the decision to take a my way or the highway approach.
Well, Republican leaders say they will talk about extending enhanced subsidies later, only after the government reopens.
Republicans have already said we were going to have thoughtful conversations, deliberation, and debate about continuing the COVID-era Obamacare subsidies.
But Democrats don't buy it based on the history we just worked through of Trump reducing subsidies, of Trump and Republicans repeatedly trying to end the Affordable Care Act altogether, and of Republicans still ripping it today.
This was not because of the pandemic. This was because Obamacare is a failed product in the first place. And they used that as an excuse in order to add additional federal dollars in.
So here's the gist of the Republican argument. The enhanced subsidies were intended to get us through an emergency, and the emergency has passed. And the government is spending billions of dollars on health care subsidies while our nation is reeling in debt. And the CBO says extending the subsidies another decade would drive up the deficit another $350 billion. And some of those subsidies do in fact go to people who make good money.
And I don't know why taxpayers in Texas and across the country should have to subsidize rich people for getting gold-plated health care plans.
Well, that also relates to Trump repealing a tax on health insurance plans for rich people. But that's not their point.
I'm happy to have the conversation about the unaffordability of Obamacare and what we might be able to do to fix that. But you can't do that while the government is being held hostage.
Now, here's the gist of the Democrats' argument. Yes, the enhanced subsidies are set to expire, but health insurance costs have shot up substantially since the pandemic. KFF research shows that plans that individuals buy through healthcare.gov are already going up around 20% on average. And if they do not extend those enhanced subsidies, it could drive up cost by 75%. It could cost many working class families thousands of dollars more to keep their health insurance.
If Republicans don't change course, then very soon 20 million Americans are going to face financial catastrophe when their health care premiums go through the roof.
Oh, for context, the cost of health insurance has shot up since the pandemic for several reasons. First, it's inflation. Inflation in health care typically lags behind the rest of the economy. Plus, we have health labor shortages while medical providers are expanding their power to negotiate higher rates.
Monopolization and consolidation of different provider networks. Large healthcare systems taking over local clinics.
Plus, we have a surge in doctors prescribing GLP-1 weight loss drugs, which can cost around $800 a month or more per patient. And insurers that cover those drugs are setting higher premiums. And they're also assuming tariffs will further drive up healthcare costs. And that's just the start.
They are going to face higher prices because of the uncertainty with the Trump administration, with the One Big Beautiful Bill Act and how it's going to affect the marketplaces.
Now, as for the shutdown, the hang up on reopening the government is in the Senate. Republicans control the Senate chamber 53-47. Most Senate Democrats, though, have not voted for the funding resolution, leaving the chamber short of the 60-vote threshold. Though Republican Congresswoman Marjorie Taylor Greene said that Republican leaders pass other stuff without 60 votes and that they could reopen the government with a simple majority as well.
I'm actually putting the blame on the Speaker and Leader Thune in the Senate. This should not be happening.
But Senate Republican leaders do not want to lower that 60-vote threshold. It could make it harder for Republicans to oppose a Democratic majority in the future, which all puts this shutdown in context and how it all relates to money, power, and politics.